All right, I created a history taking scavenger hunt through PowerPoint, which I've never done before, but I'm pretty pleased with it. So accompanying the PowerPoint scavenger hunt, our students, they will get a worksheet accompanied. So I teach the radiologic technology program, and within the patient care class, they have to learn how to take a history for our radiologists due to our radiologist having limited time and not looking up any information in the patient's chart. So we give that information directly to the radiologist. So on the worksheet, they will need to find the patient's name and birthday, the exam to be completed, the patient's chief complaint, the patient's pain level, the chronology of the chief complaint, the objective data, the subjective data, and ultimately the diagnosis as explained by the radiologist. So this is the history taking scavenger hunt. They are going to be clicking interactive points to obtain their needed information. So we're going to start. This is the tech work area. We will need to look at the requisition. And this gives us our patient's name and birthday and the type of exam that's going to be done, plus the ordering doctor. Then clicking on the computer, this is the patient's chart. So again, this gives us a little bit more information. The patient states that her pain has bothered her for 2 years and it's getting worse and nothing is making it better. And there is shooting pain down the left leg. This is our subjective data, as well as the pain score. And then right underneath of that is the vitals. And this is where the students will obtain their objective data for the worksheet. Now that we have collected everything we need, we're going to go get the patient in the waiting room. The tech calls the patient, identifies them, and then it's time for some imaging. There is a script along with this just in case they didn't gather the necessary information they needed before. Of course, they can always backtrack. So the patient leaves and then we need to put in some information for the radiologist. So this will give them a real life example of what kind of information will need to go to the radiologist that is pertinent to the exam. We do teach the students to not put any information in there that's not pertinent to the exam because the radiologist has limited time. All they want is the information that is directly related to the chief complaint and to the patient's complaints. Then we follow up with the radiologist to find out the diagnosis, which will complete their worksheet. And yeah, that's pretty much it. And then I have some references listed, of course, for some of the imaging used. Most of them were stock photos. I really did enjoy this assignment. This was great. I'm super excited to implement it next year within my patient care class. So I really do appreciate it. Appreciate your time, and I thank you.